Hey everyone, it's V. We're talking about something that might feel a little awkward to bring up, but let's be real, constipation happens to the best of us. It's actually incredibly common, but how do you know when it's time to stop Googling home remedies and actually pick up the phone to call your doctor? We're breaking down all the red flags in this video, so stay tuned. We'll cover when it's more than just a few days of discomfort and actually a sign that you need to get checked out by a medical professional. Because remember, taking care of your health is important. And sometimes that means facing those slightly less glamorous topics head-on. Let's get to it. Okay, so first things first, let's talk about what we mean by chronic constipation. Basically, if you're struggling to empty your bowels regularly and it's been going on for 3 weeks or longer, that's when you want to start paying attention. It's not just about feeling uncomfortable. Chronic constipation can actually be a sign of other underlying health issues. We're talking hormonal imbalances, problems with the nerves and muscles in your digestive system, or even issues with your diet and lifestyle. Now, I know some people might brush it off as no big deal, but trusting your gut, literally, is important. Your body is pretty amazing, and those signals it sends, yeah, those are worth listening to. Don't ignore chronic constipation, especially if it's become a regular part of your life. It's always best to get things checked out by a doctor to rule out anything serious and get you back to feeling your best. Next up, let's talk about those times when constipation comes with some pretty unwelcome friends: severe pain and bloating. We're not talking about a little discomfort here. I mean the kind of pain that makes you stop in your tracks, or bloating that has you feeling like a balloon. Those are your body's alarm bells, and it's crucial to pay attention when they go off. These symptoms, especially when they occur together with constipation, could indicate a more serious underlying condition. We could be talking about intestinal blockages, issues with your gallbladder, or a whole host of other possibilities that require medical attention. Remember, I'm not here to scare you, but I am here to give it to you straight. Ignoring these symptoms won't make them go away. In fact, putting off seeing a doctor will only make things worse in the long run. So, if you're experiencing severe pain or bloating along with constipation, don't hesitate. Get yourself to a doctor ASAP. Alright, let's talk about a symptom that tends to make people understandably anxious: blood in your stool. I know it can be scary, but it's crucial to face that fear head-on and seek medical advice right away. Now, before you jump to the worst-case scenario, it's important to remember that blood in the stool doesn't automatically equal something terrifying like cancer. It could be something as common and easily treatable as hemorrhoids or anal fissures, especially if the blood is bright red. However, it's not up to us to self-diagnose. That's why seeing a doctor is crucial. They can determine the underlying cause of the bleeding and recommend the appropriate course of treatment. Remember, early detection is key when it comes to any health concern, and that includes potential issues in your digestive system. So please don't delay. If you notice blood in your stool, make that appointment. Now, this next sign might seem unrelated to constipation at first, but trust me on this one. If you're experiencing unexplained weight loss, especially along with changes in your bowel movements, it's time to take notice. Here's the thing. Our bodies are complex, and sometimes seemingly separate issues can be interconnected. Unexplained weight loss can be a sign of several underlying health problems, some of which might also manifest as constipation. For example, conditions affecting your metabolism, hormonal imbalances, or even certain types of infections can lead to both weight loss and constipation. It's like your body is trying to send you a signal, but it's coming through on two different channels. That's why it's crucial to see your doctor and provide them with a complete picture of what's going on. They can then run the necessary tests to pinpoint the root cause and recommend the most effective treatment plan. Last but not least, let's talk about something that's often overlooked but incredibly important: your family history. We all know that genetics play a role in our overall health, and that includes our digestive health. If you have a family history of colon cancer, inflammatory bowel disease, IBD, or other digestive diseases, it's vital to be extra vigilant about your bowel health. This doesn't mean living in fear, but rather being proactive and taking charge of your well-being. Talk to your doctor about your family history and discuss whether you should be screened earlier or more frequently for certain conditions. Regular checkups and screenings can make all the difference in detecting and managing potential problems early. Remember, knowledge is power. By being aware of your family history and working closely with your healthcare provider, you can make informed decisions about your health and potentially prevent serious conditions down the line. That's it, everyone. We've covered 5 important signs that it's time to see a doctor about your constipation. Remember, your health is your most valuable asset, and early detection and treatment can make a world of difference. If you're experiencing any of the symptoms we discussed today, don't hesitate to schedule an appointment with your doctor. They're there to help you feel your best and address any concerns you might have. Thanks for tuning in, and don't forget to hit that subscribe button for more informative and engaging health content. Remember, taking care of your health is always worth it.